Hi, my name is Acacia. I'm originally from Arizona, but I went to medical school at the University of New Mexico. I chose Stanford because the residency program here is really invested in us building our future careers while in residency. And I have a specific ambition to be a physician scientist, and they've been incredibly supportive of that so far. And I'm really excited to be here. And I am also really excited to learn more about ultrasound.
Hi, my name is Lamley Lawson, and I'm from Ridgeland, Mississippi. My family's from Ghana. I went to school at Yale in Connecticut, and now I'm on the West Coast. And I chose Stanford for a lot of reasons. One of the biggest reasons was because they, in addition to training you to be in an excellent emergency position, they also encourage and foster your desires, your passions, the EM plus position you want to be. So for me, that was really, really important. What I hope to get out of my time at Stanford, amazing faculty are a dime a dozen here. And so I hope to get involved with some of the global health work, some of the social EM opportunities, using innovation as a means to achieve health equity. There's so many opportunities. So innovation, global health, social EM, I hope to get a little bit of it all.
My name's Paula. I'm originally from Maryland. I did medical school at WashU in St. Louis. Very excited to be here at Stanford. I chose Stanford because of all the amazing research opportunities and the resources that Stanford has. And of course, being in Northern California is amazing. And I'm very excited to focus on, of course, emergency medicine, but also critical care as well throughout the next 4 years.
Hi, my name is Annie Manella. I am from Los Angeles, and I chose Stanford because of the incredible training and resources and also amazing vibes on interview. I am interested in exploring social EM, ultrasound, and medical education.
I'm Kate Stone. I'm from Central Texas, and I chose Stanford because as someone who's still trying to figure out what their long-term career in emergency medicine will look like, Stanford has endless possibilities and mentorship to help tease that out and figure it out. But what I'm really excited to start exploring is the world of health policy and improving health equity.
Hey, everybody. I'm Sean. I grew up outside of Boston and moved here from Connecticut. I chose Stanford because I wanted to be in a place with amazing outdoor spaces, hang out with awesome people, and be in a hospital that had everything. I think Stanford fits that bill. And something I'm super excited to learn more about is aerospace medicine and space, because that's something I'm really interested in.
Hi, I'm Dr. Jacob Razuk. I'm from Loma Linda, California, and I chose Stanford because I think it's the #1 institution in the world. I mean, where else are you going to find a higher density of faculty who are like the experts in their field and just at the forefront of innovation and really pushing our understanding of medicine? So I think that's pretty cool. And while I'm here at Stanford, I hope to conduct high quality research and develop innovations to improve patients' lives as well as their loved ones. So wish me luck.
I'm Conrad. I'm originally from Redwood City, California, very close by. I chose Stanford because I'm really excited to come back to this community, help this community, and also just like learn alongside and from all of the wonderful people. I love medical education, technology, the intersection of those. And I'm really excited to be here for these next 4 years.
Hey, I'm Jordan. I'm from Orange County, California. I chose Stanford because of the amazing people, the location, and the endless opportunities. I'm most excited to get involved with people who are working on really interesting stuff, AI innovation, as well as pain medicine.
Hi, my name's Nina. I am from the Seattle area, and I went to the University of Washington for medical school. And I wanted to come to Stanford for a couple of reasons. One was the global health opportunities. They just have some really good concrete connections in a bunch of places, and I was excited about that. And I have a background in engineering, and I was really excited for the medical device design. It's kind of hard to find that niche in other places, and so they've got a wonderful innovation conference here that I've been excited about. And so going forward, I'm excited to learn more and do some projects within medical device design and get to know the EMS in the area. It's a fellowship I'm considering, and so I'm excited to explore that niche and those multiple interests over the next few years.
Hi, my name is Kai Feliciano. I am from Manila, Philippines. I went to school in LA at Kaiser Permanente School of Medicine. I chose Stanford for their global health opportunities and the ability to go all over the world and do work in health equity and really navigating improving health in the global south. And so that's something I'd like to focus on when I'm here during residency as well.
My name is Sophia. I'm from Santa Barbara. I am super excited to learn more about global health at Stanford. And I chose Stanford for the incredible team resources and the opportunities to move emergency medicine and their healthcare system forward.
Hello, my name is Ryan Lasinski. I'm originally from Pittsburgh, Pennsylvania. I completed my MD PhD at the Western University School of Medicine in Morgantown, West Virginia. I specifically chose Stanford because I'm really interested in their Physician Plus program, which will not only train me to particularly become a very good emergency medicine doc, but also begin to explore what my future career will look like 10, 15, and 20 years down the line. I would say that I'm interested in learning more about how my skill set as an emergency medicine doctor can not only be used in hospitals, but even further out in our communities as well as within private industry.
I'm Anjay. I'm from Akron, Ohio, the Midwest. I chose Stanford because of the people around, the weather, and also the breadth that Silicon Valley has to offer. And then in terms of my interests, I am, obviously wanting to work on clinical medicine and being a master at that, but also interested in narrative medicine, sports medicine, and medical education.
Hey, I'm Nimit. I'm from North Carolina, and I went to med school in San Diego at UCSD. I was really excited to choose Stanford because of the excellent training that we get here from the faculty, from the residents that I saw here on my away rotation, and the fact that we get access to multiple sites to train at, like Kaiser, Stanford, Santa Clara Valley. That was one thing that was very important to me. Secondly, I love the atmosphere of innovation here from the engineering school, the business school, law school. It's very interdisciplinary, and I am personally very interested in digital health. And so I'm hoping to get involved with faculty here who are building and implementing some of the newest tools in the emergency department. And I hope to get involved with some digital health work here with faculty that are working on building tools for emergency department physicians and staff, as well as some population health management for our community here in the South Bay.